A brief overview of diseases caused by microbial pathogens. Brought to you by Scientist Cindy. Disease is a disorder of structure or function in a human, animal, or plant, especially one that produces specific signs or symptoms that affects a specific location and is not simply a direct result of a physical injury. An allergy is an immune response that is actually harmful to the host rather than protective. The immune system of allergy sufferers have misidentified otherwise harmless substances as something pathogenic. There are 3 different types of allergic reactions that we'll discuss briefly. The first is hay fever or allergic rhinitis. These are mild allergic reactions resulting in symptoms that are much like the common cold. These include sneezing, congestion, and sinus pressure. The second type are breaking out in hives. These are mild to moderate allergic reactions that result in red, itchy, raised welts on the skin that persist between 6 and 12 hours. The most dangerous type of allergic reaction is anaphylaxis or anaphylactic shock. It is a life-threatening allergic reaction that results in a drop of blood pressure and swelling and constriction of the airways. Allergies are actually caused by type 1 hypersensitivity. Type 1 hypersensitivity is the result of an immune response that is oversensitive. Type 1 hypersensitivities involve the immunoglobulin E, or IgE, antibody against soluble antigen. This triggers mast cell degranulation. Autoimmune diseases. Autoimmune diseases are caused by a dysfunction of the immune system where an individual's own healthy cells are mistaken for foreign pathogens. The immune system launches an attack on the specific cells that it has misidentified as harmful. Autoimmune diseases result from a breakdown in immunological tolerance. The actual induction events that lead to the activation of different autoimmune states are still being worked out. Some of the ones that are maybe a little bit more known would be Graves' disease, lupus, asthma, eczema, psoriasis, rheumatoid arthritis, fibromyalgia, multiple sclerosis, autism, and Crohn's disease. Diabetes mellitus type 1 is an autoimmune disorder in which the T cells of the immune system begin to attack insulin-producing beta cells of the pancreas. The beta cells in the normal islet cells of the pancreas are able to release insulin in the body, which allows the sugar in the bloodstream to be accessed and metabolized. This lowers the blood sugar level in the body. Some of the symptoms that are involved with type 1 diabetes includes fatigue, frequent urination, weight loss, wounds that might not heal, possible vaginal infections and sexual problems, increased thirst, tingling or numbness in the hands and feet, blurred vision, and increased appetite. Immunodeficiency diseases can be either primary or secondary. Primary immunodeficiencies are caused by genetic abnormalities, whereas secondary immunodeficiencies are acquired through either disease, diet, or environmental exposures. One example of a primary immunodeficiency is severe combined immunodeficiency disease. Deficient humoral and cell-mediated immune responses is one of the devastating effects of this disease. Early development of severe and life-threatening opportunistic infections is often experienced. We also have X-linked A-gamma globulinemia, which is the flawed differentiation of the B cells of the immune system that causes an absence of specific antibodies. This leads to recurrent infections almost exclusively due to pathogens that cause tissue infections, which generate pus. Pus is caused by dead white blood cells. Secondary immunodeficiencies include the HIV virus and AIDS. The HIV virus is going to have the effects of having impaired cell-mediated immune responses due to the CD4 T cell lymphopenia. Opportunistic infections and rare cancers can result. Acquired immunodeficiency syndrome, or AIDS, is caused by the HIV virus and is the progressive failure of the immune system to allow life-threatening opportunistic infections and cancers to thrive. This is a scanning electron micrograph of HIV-1. There are three main stages of HIV infection. Starting with acute infection, 40 to 90% of patients experience between 1 and 3 weeks of various symptoms that are so easily dismissed as symptoms due to more common illnesses. These are overlooked by physicians as well as by the people suffering the symptoms themselves. These can include rash, fever, aches, pains, weight loss, fatigue, nausea, swollen lymph nodes, and even sores on the body. Then after that, you have a clinical latency, and the clinical latency can last between 3 and 20 years, depending on if the person gets treated. And actually, if a person can get treated, we've actually seen some strains of HIV that have been able to be controlled by antiviral medications and that have not progressed on to AIDS. So it's a very important thing to be able to get an early diagnosis, because that's really going to help a person's chances of being able to live a healthy, full life. The clinical latency can last from 3 to 20 years and is asymptomatic, so with no symptoms. So if HIV is able to progress to a certain point, then AIDS is the end result. This is characterized by various symptoms, including encephalitis, meningitis, retinitis, chronic diarrhea, tumors, esophagitis, and pneumocystis pneumonia. So when is the tipping point? When does an HIV infection become considered AIDS? The diagnosis of AIDS is given when either one or both of these conditions are met. A diagnosis of AIDS is given when or if the CD4 T cell count is below 200 cells per microliter, or a diagnosis of acquired immunodeficiency syndrome or AIDS can be given when or if the occurrence of a specific disease that is associated with immunocompromised individuals occurs. The most common of these early warning diseases is pneumocystis pneumonia. In fact, 40% of HIV patients that develop AIDS develop pneumocystis pneumonia as their first AIDS-acquired disease due to immunodeficiency. There are also other causes of immunosuppression. Immunosuppressive therapies such as chemotherapy or radiotherapy used to treat cancers, immunosuppressant drugs that are given following organ or tissue transplants, and these cause impaired humoral and or cell-mediated immune responses as well. And interestingly, malnutrition can also suppress the immune response. So, diseases of the skin and eyes. We have Staphylococcus and Streptococcus, and of course there are many strains, and these cause many different types of skin infections. One of them that's important to note is the MRSA, methicillin-resistant Staphylococcus aureus, or MRSA. This is a drug-resistant strain of Staphylococcus, and it is drug-resistant to a wide range of antibiotics and is commonly found in hospital settings. So group A streptococci, or GAS, is often responsible for cases of cellulitis and also one of the many possible causes of the necrotizing fasciitis like we see here in this photo. We also have fungal infections of the skin that are called mycoses. Mycoses can be cutaneous, subcutaneous, or even systemic. Common cutaneous mycoses include tinnitus, caused by dermatophytes of the genre Trichophyton, Epidermophyton, and Microsporum. Tinea is called ringworm, but it's not a worm, it's a fungus. Tinnitus on other parts of the body have names associated with the affected body part. Aspergillosis is a fungal disease caused by the mold Aspergillus. It's primarily cutaneous, and it enters through a break in the skin, such as the site of a surgical wound or a physical injury. It is also a common hospital-acquired infection. In secondary cutaneous aspergillosis, the fungus can enter via the respiratory system and then can disseminate systemically, manifesting in lesions on the skin. The most common subcutaneous mycoses is something called sporotrichosis, otherwise known as Gardner's disease. You can also get fungal infections under the nail, such as this candidiasis. It can be seen here as the yellowing of the nails. There are also parasitic infections of the skin and eyes. The protozoan Acanthamoeba causes Acanthamoeba keratitis. It is a parasitic infection of the eye that often results from improper disinfection of contact lenses or from swimming while wearing contact lenses. The Helminth loa loa is a parasitic worm that causes loiasis. Loiasis, which translates as eyeworm, is a disease endemic to Africa that is caused by the parasitic Loa Loa worms that infect the subcutaneous tissue of the skin and eyes. The Loa Loa worm and loiasis is transmitted by deer fly vectors. Influenza is caused by the influenza virus. Influenza can be prevented with vaccines that are made up of an inactivated form of the virus. Bacteria pneumonia results from infections that cause inflammation and fluid accumulation in the alveoli of the lungs. It is most commonly caused by S. pneumoniae or S. influenzae. Tuberculosis, or TB, is caused by Mycobacterium tuberculosis. Infection leads to the production of protective tubercles in the alveoli and calcified gong complexes that can harbor the bacteria for a long time. Pertussis, or whooping cough, is caused by the Bordetella pertussis. Mucus accumulation in the lungs leads to prolonged severe coughing episodes, or whooping cough, that facilitates its transmission. Despite an available vaccine, outbreaks are still common. Legionnaire's disease is caused by an infection from environmental reservoirs of the Legionella pneumophila bacterium. The bacterium is endocytic with macrophages, and infection can lead to pneumonia, particularly among immunocompromised individuals. You can also get fungal infections of the respiratory tract. Fungal pathogens are easy to kill in healthy individuals. However, on rare occasions or in immunocompromised patients, the inhalation of fungal spores can cause disease. Aspergillosis, caused by Aspergillus, is a terrible infection of fungus that can exist in immunocompromised individuals. The hyphal balls from the fungus may impede lung function, and they can continue to grow into the tissues and cause damage, as we see here. Disseminated forms can even lead to death. Diseases of the urogenital system. Diseases caused by bacterial pathogens include gonorrhea, which is associated with symptoms of urethritis. If it's left untreated, it can progress to epididymitis, salpingitis, and pelvic inflammatory disease. It can also enter the bloodstream to infect other sites inside the body. Chlamydia is the most commonly reported STI and is caused by C. trachomatis. Most infections are asymptomatic or involve pain with discharge. Chlamydia can lead to pelvic inflammatory disease or sterility if left untreated. Syphilis is caused by T. pallidum, which is associated with painless hard canker lesions on genitalia. Here we can see the progression of the sore, which is stage 1. If left untreated, the sore can evolve into a body rash, and later, within 3 to 15 years after infection, can infect the internal organs as well. There are also viral pathogens that can cause urogenital diseases. Genital herpes is caused by HSV2 and may cause the development of infections and potential recurrent vesicles. Another viral condition is the human papillomavirus, or HPV, it is the most common sexually transmitted virus and includes strains that cause genital warts as well as strains that can lead to cervical cancer and other cancers as well. Some of the diseases that affect the digestive system include H. pylori, hepatitis, ascariasis, hookworm infection, and trichinosis. H. pylori is associated with peptic ulcers. Peptic ulcers may lead to bleeding or perforation in emergency situations. Hepatitis can be caused by the hepatitis virus. There are many subtypes, A, B, C, and D. Hepatitis viruses differ in their modes of transmission and treatment and their potential for chronic infection. Ascariasis is a disease of the digestive system that is transmitted through contaminated food or water. This is due to the Ascaris lumbricoides eggs, which are transmitted through the contaminated food or water and hatch in the intestines of the person that ingested it. Juvenile larvae travel to the lungs and then to the pharynx, where they are swallowed and then return to the intestines to mature. These nematode roundworms cause ascariasis. Hookworm infections. Hookworm infections can be caused by Necator americanus and Ankylostoma duodenale. When these larvae penetrate the skin from contaminated soil due to dog or cat feces, they can travel to the lungs and then be swallowed. Once swallowed, the hookworm can then mature in the intestines. Trichinosis is another disease of the digestive system. It is transmitted through undercooked meat. The larvae, the Trichinella larvae, in the meat emerge from cysts and mature in the large intestines, where from there they can migrate to muscles and form new cysts, which causes the disease trichinosis. There are also diseases of the lymphatic and circulatory systems. The circulatory system moves blood throughout the body and has no normal microbiota. The lymphatic system moves fluids from the interstitial spaces of tissues toward the circulatory system and filters the lymph fluid. It also has no normal microbiota. The circulatory and lymphatic systems are home to many components of the host immune defenses. The lymphatic system encompasses a network of vessels, glands, and organs located throughout the body. Functioning as a part of the immune system, it also transports fluids, fats, proteins, and other substances in the body. The lymph nodes, or glands, filter the lymph. Foreign bodies, such as bacteria and viruses, are processed in the lymph nodes to generate an immune response to fight infection. Infections of the circulatory system may occur after a break in the skin barrier, or they may enter the bloodstream at the site of a localized infection. Pathogens or toxins in the bloodstream can spread rapidly throughout the body and can provoke systemic and sometimes fatal inflammatory responses, such as SIRS. Infections of the lymphatic systems can cause lymphangitis and a lymphadenitis. Lymphangitis is defined as inflammation of lymphatic pathways. It is caused by an infection near the end of one of the lymphatic pathways. Since the blood-brain barrier is able to keep most microbes from being able to enter the brain from the bloodstream, there is no normal microbiota in the CNS, or central nervous system. Some pathogens do, however, have specific virulence factors that allows them to breach this blood-brain barrier. Inflammation of the brain, or meninges, caused by infection is called encephalitis or meningitis, respectively. These conditions can lead to blindness, deafness, coma, and death. For example, symptoms of bacterial meningitis include fever, neck stiffness, headache, confusion, convulsions, coma, and death. Diseases of the nervous system. African trypanosomiasis. It's a mouthful. African trypanosomiasis is a serious but treatable disease endemic to two distinct regions in sub-Saharan Africa, caused by the insect-borne hemoflagellate Trypanosoma brucei. Thank you for watching.